Hello, my name is Jensen Smith, and for my sports med project number 2, I decided to do my project on shin splint prevention. My patient for this project was Basil D'Angelo. He's a track athlete at STHS, and he has a history of bilateral shin splints. So, what are shin splints? Shin splints or medial tibial stress syndrome is caused by the muscles of the anterior calf, especially the tibialis anterior, pulling bones off of the tibia. So, microfractures caused by the tightness in the tibialis anterior pulling off bone from the tibia. It is a chronic injury, and it is only considered to be a true shin splint if the pain is localized on the medial side. Pain can occur on the lateral side, and it is still considered a shin splint, but it is just slightly different and also just not considered a true shin splint. There are a variety of causes for shin splints. Changes in training is one of them, either in intensity, how violent it is, the surface you are running on. So if you go from grass to roads, and the frequency, obviously how often you do it. Additional causes are shoe fit, which when you don't have enough arch support in your shoe, your foot tends to pronate, and that causes a lot of stress to be put on the tibialis anterior. Improper gait is a less common one, but still noticeable when it is incorrect and also causes stress to the tibialis anterior. And then flat feet goes along with shoe fit. If you don't have any support in your arch, your feet will pronate and have that valgus force and just uh, tighten that tibialis anterior to such a major degree. If you do have shin splints, the major recommendation is to just cease all painful activity that you can. Ice your shins 20 minutes every 2 hours and take anti-inflammatories, and they should go away on their own. If you can bear to run, only run on softer surfaces, just for your own benefit. My goals for this project were to examine his feet and examine his shoes to see if the pronation was there, and that's why he was getting the shin splints, and then to make a custom program in order to help him relieve his pain and stop them in the future. So we examined his feet, and he has very flat feet, which definitely increases his risk. As you can see, there is not very much arch right here, and that's very concerning. So his pronation is just ridiculous, and his tibialis anterior is getting stretched so much. Number two, his shoes. He only wears Converse and Vans, and that also just gives no arch support, furthering that pronation and valgus force on his ankle. He is not helping himself out. Goal three for the program, I just had these two goals because I can't change his anatomy. So I was stretching the anterior calf, so mostly the tibialis anterior, and then strengthen the gastrocnemius and the soleus. Um, For the stretching, I did the standing shin stretch and the sitting shin stretch, mostly because the sitting shin stretch looks really silly, and I wanted to make my friend do that. But they did, in fact, help. Additionally, I had him roll out his tibialis anterior and use a lacrosse ball on his shin whenever he could. And he said that this was the most painful, but also the most rewarding in pain relief. So take that as you will. Um, for the strengthening, I did calf raises with his toes pointed out and in. This is to target different areas in the gastrocnemius and the soleus. And then additionally, I had him do gas pedals with a TheraBand, which was just a nice, easy exercise that he could do pretty much wherever. Uh, he had a TheraBand at his house, so it was just simple for him to do. The results, he liked the program, and his shins felt more relaxed and loose. But just by his very own nature, he's not going to continue this program. He even told me so. But he did acknowledge that it did help him at least minorly. I told him to go get orthotics, and hopefully he will, because that is another major step to prevention for shin splints. Uh, from this project, I learned that mostly that shin splints are caused more by anatomy than almost anything else. And additionally, I learned that not all patients want to continue to get better, which was a hard pill to swallow in the medical profession, but it's all right. Thanks for watching.